265-5807.
Welcome back. Dr. Ryan Szepiela is here with the answers to your questions when it comes to your good health. Doc, let's start off with this first caller. They said, I need knee surgery, but my doctor says that I have to stop smoking before I can have surgery. They want to know, why does this matter?
Well, I think your physician is just trying to protect you and avoid any complications. We've found out through multiple studies that smoking interferes with several stages of healing. So it interferes with the way the body tissue and the healing process uses the oxygen to heal. And this is required in your system to heal muscles, bones, ligaments, and tendons. And it also thickens your blood, which doesn't allow the blood not only to get where it's supposed to go to heal, but also can increase your risk of serious complications such as blood clots. So throughout healing, throughout getting better, and not only musculoskeletal injuries, it's in your best interest to quit.
All right, and if it doesn't matter how soon before the surgery you stop?
It does. You know, obviously we see effects, but definitely a couple weeks before the surgery would be necessary.
All right, Doc, our next caller wanted to know from you today. I hurt my elbow, they say, throwing with my son. It's been going on for 10 days. I called to get an MRI done, and my doctor said no. Instead, my doctor, and I'll continue with the question, my doctor set me up with an appointment in office. Why can't I just find out what's going on?
It's a question I get asked all the time. Obviously, you want to know what you did before we start to treat it, but that's not always necessary. So a lot of these tests aren't necessary before we start treating you, and a lot of them aren't necessary to actually get resolution of your issues. An MRI will show us muscles, bones, tendons, ligaments, but it only needs to be done in case we think something's torn or you need to go on to further testing. In order to start into conservative treatment, whether that just be light medications and some exercises or even icing, we usually don't need an MRI. I would recommend getting a full evaluation to see if any imaging is necessary, and most of the time we would start with an x-ray.
Okay. And 30 seconds now, my daughter continues to complain of knee pain playing soccer, but continues to do well. Should we have her evaluated for these, mild complaints?
Absolutely. Anything that continues in a child or even an adult should be evaluated by a healthcare provider. We're just seeing this more often with sports specialization. You play the same sport all year round now, which a lot of parents have gotten into, and a lot of kids for several reasons, but it ends up aggravating the same injury over and over again. But remember, kids have growth plates and kids have other susceptible injuries that we need to evaluate and make sure we're not doing any damage for the future.
All right, Doctor, good stuff as always. We'll see you next time.
Thank you.
You bet. Coming up tomorrow, we'll talk more about your legal matters. An attorney here in our studio. You can email us ahead of time at